Hi guys, welcome to today's episode of the vlog series. Today we're going to talk to you about UKMLA and what we know so far. Okay, so what is the UKMLA? Well, the acronym has been bandied around for a little bit of time now, and eventually it's going to come in to replace the PLAB examination for international medical graduates coming into the UK. So if you're coming in through the Royal College route or the postgraduate qualification route, it won't apply to you. But if you're coming through PLAB, then the PLAB will be replaced by the new assessment UKMLA in 2023. Okay, so what we know so far is that the UKMLA is going to consist of two parts in a similar way to the PLAB examinations. The first part is going to be the applied knowledge test. The applied knowledge test is going to be an on-screen clinical assessment similar to PLAB 1, where you'll be asked multiple choice questions from a selection. You can't move on to the second part until you've completed the applied knowledge test. The second part is the CPSA, the Clinical and Professional Skills Assessment. Now that's going to run in much the same way as the PLAB 2 assessment at the moment, so you'll have multiple stations at the Clinical Assessment Centre for the GMC, which is in Manchester in the UK. We're anticipating it's going to be exactly the same in the sense that you're going to have to fly to the UK to sit it. It won't be available at the international test centres. Okay, so what do we know so far about how to prepare for the UKMLA? Well, fortunately, the GMC have given us a guideline, a content map for the material that's going to be studied. It's got 6 points on there at the moment, the first of which is areas of clinical practice. So it's going to test your understanding of the various parts of medicine, surgery, geriatrics, all those things in the context of a kind of complex medical care system like the NHS. The second is areas of professional knowledge. So this will be around things like not just your clinical practice, but ethics and biomedical sciences and all of the other things that come alongside your clinical practice. The third is clinical and professional capabilities. So that's obtaining information about patients, formulating a prioritised plan, a list of problems, diagnoses for patients, that kind of thing. Patient representations, so we're going to be looking out for the signs, symptoms, investigation results, and how you process those for the normal things that you would see as a foundation level doctor if you're in the NHS. Your practical skills as well, which are constantly updated in the outcomes guide for graduates. There's a recently published one on the GMC's website. And then conditions as well. So this is around the appointments and the kind of patients that you would see in your first role in the NHS if you're coming in at foundation doctor level. So there's a whole host of stuff. We'll put a link up to it with all the things that you're going to be potentially tested on. Obviously we don't know the specific questions, we haven't got any practice papers or anything like that yet, or practice scenarios, but hopefully we will do soon, and we're starting to see more and more detail coming through from the GMC on what to expect. Okay, hopefully that's been of some use in telling you a bit more about UKMLA. Obviously we will keep you updated as more and more information comes through from the GMC, but if you've got any questions in the meantime, please feel free to get in touch. As always, we'll put the contact details up at the end of the video.